Hi, everyone, and welcome to ICU Liberation. My name is Courtney, and I'm going to be your instructor for this course. So I'm going to tell you a little bit about myself, and then I'm going to tell you what you can expect in this module. So I became acquainted with the ICU Liberation for the first time in 2014 when the hospital that I work at decided to implement it in my ICU. So I've worked in a surgical trauma ICU for about 8 years. 2 of those years have been as the educator for that unit. And I experienced a lot of the growing pains that come along with implementing the ICU Liberation Bundle. You're going to notice as you move through this module and as you go about the world that you'll hear some terms kind of being used interchangeably, and that is the ABCDEF bundle and ICU Liberation. The preferred terminology now is ICU Liberation, but because some people still think of it as the A through F or ABCDEF bundle, I use that a little bit as well as we move through the module. So as far as what you can expect moving through this course, it is designed for you to be able to click the next button. But the next thing you're going to do after you watch this introduction is you're going to go and introduce yourself to us. You can do that via video, or you can just type a quick response, whatever you prefer. And then if you just wouldn't mind overlooking the objectives, there's just 2 for this course. And then there is a discussion board. It's called the ICU Liberation Q&A. So you can go there. Feel free to pose any questions to each other, to me. I will respond to all of those questions within 24 hours. Then there's the to-do list. So the to-do list is pretty simple. There is a PowerPoint that you can review. There is a 10-minute lecture that's just me speaking to a lot of the concepts that of what the A through F bundle looks like. There are 3 demonstration videos where nurses are doing an excellent job performing an ICU Liberation handoff. And then there is an article that you can read. And then optionally, there is a podcast available for you to listen to, which is just a bunch of critical care PAs sitting around and talking about the victories and pitfalls of the ICU Liberation. So however you prefer to learn. As far as proving your competency for this class, I've given you 2 options, whichever works best for you. The first one is to submit a demonstration of you performing an A through F or ICU Liberation handoff. If you choose to do that option, you will need to review somebody else's or 2 other people's in order to prove your proficiency. The second way is to complete a post-test with 80% accuracy. Whichever one works best for you. There are rubrics for the video demonstration, and then you'll get your score immediately if you choose to do the post-test. But I hope that you learn a lot. I can't wait to hear your feedback, and I hope that it becomes a part of your day-to-day practice. Thank you so much, and I hope you enjoy.